I'm one of the health advisors here and welcome to the Sexual Health Clinic. This is where patients will come in and wait for their appointments to be seen by the doctors or nurses, and reception here is where they take all their details and make up notes for our patients.
Sexual health clinics, sometimes called genito-urinary medicine or gum clinics, offer free services for everyone any age.
Initially patients are called through to have their histories taken first of all, so we can ascertain what swabs we need to do, what tests we need to do, and the risks that patients have.
Hello, you got an appointment?
No.
We'd need to get you assessed by a nurse. Have you been to us before? No? Could I just get you to fill out one of our forms?
I've got dyslexia, can you help with this?
Of course, yes.
Okay.
My name's Nicole and I work on reception in sexual health. To get seen in our department, if you're over 19, you do need to make an appointment in the hospital. But if you're 19 and under, we run a youth clinic where all you need to do is drop in. That's great. If you could just take a seat and someone will call you through. Okay.
Thank you.
Opening times at clinics vary, and sometimes you might need to make an appointment. It's best to contact them beforehand to find out.
I've got an appointment at 10:30 for the health clinic.
Okay, what's your name?
Anna Young.
Okay, can I just get you to fill out
Sure.
this form for us, okay?
Okay.
If you have had sex, you could have a sexually transmitted infection and not know it. Often, there are no symptoms.
For a lot of people, they do not get any symptoms with any of the infections. But if people did, then for men, possibly they may get a discharge, which is usually a yellow colour, and possibly a little bit of pain when they pass urine. For women, they may get similar sort of symptoms, but generally the women don't get any symptoms at all.
Marie. Hi, I'm Dr. Heaton, and you are Marie, is that right?
Yes, that's right.
So how can I help?
My boyfriend got chlamydia, so I thought I'd have a check-up just to see.
That sounds like a good plan. So have you noticed any problems yourself?
Got lower abdominal pain,
Right. And how long's that been going on for?
about 2 weeks.
Right. And is it there all the time, or does
No,
it
comes and goes?
Right. And is it getting worse, or has it stayed pretty much the same?
It's pretty much the same.
Okay. My name's Jo, and I'm a doctor in the sexual health clinic. Very often people come to see us who have no obvious problems, but they're worried that they may have developed a sexual infection. But if you do have particular problems, when I talk to you, that's the opportunity for you to tell us what those are. I'll then want to know how long the problems have been going on, and also some simple background information about how your general health is, what tablets you might be taking, and if you have any difficulties with your day-to-day life. After that initial information, I then need to ask you some questions about who you've been having sex with and when that was, and maybe what type of sex that was. People are very often find these questions a bit intrusive and wonder why we need to know all the details. It's not just because I'm being nosy, it really is because I do need to know exactly what sort of risk you've been putting yourself at. What we'll do today is to do some swab tests so that we can just check there's nothing else there, and then we will give you treatment today for the chlamydia. So it's 1 week of antibiotics,
Okay.
1 in the morning, 1 at night, and just take them for 7 days, and then the chlamydia will be gone.
Okay, and it will be gone.
It'll be sorted.
Oh,
Yeah.
okay.
Okay.
And no sex in that week?
No sex while you're on treatment, and you
Okay.
also, your boyfriend needs to have some treatment, so the best
So
thing
he
is
has to come back
yeah,
again?
Yeah.
Some STIs can lead to serious complications, if you leave them untreated. Don't wait, go for a checkup.
Unfortunately, we don't see very many people with disabilities in the clinic here. I think it may be because people don't know that we're here and that we're easy to access, but also it may be that the people who look after people with disabilities have the strange thought that disabled people don't need to come to a sexual health clinic, which of course isn't true if they're having sex. So we'd love to see more people with disabilities in the clinic, and I think we're pretty well set up to cope with most things.
Most modern sexual health clinics are fully accessible. If you have any questions, contact them and find out.
The last thing I'm going to do is just to examine you and make sure there aren't any tender patches. Okay? Just feel like that.
Tests can include a physical examination, some swabs from the genitals, and urine and blood tests. They are quick and painless.
It's the first time I've been to a clinic like this, and the subject being the subject, it kind of makes me feel more nervous.
So well done for coming here today. It's actually sometimes quite difficult to come to a place like this, to actually talk about sex and talk about those things. But what we can do today is I can actually introduce you to someone who can talk a little bit more detail about relationships and about sex.
Yes, I would be very happy to see her.
The important thing about here is everything's confidential. So no one knows that you've been here today unless you decide to tell them. So this information isn't shared with your GP and it isn't shared with anywhere else in the hospital.
Even if you're under 16, you have the same right to confidentiality as adults.
Health advisors are there for any questions that people have, really, any concerns about their sexuality. It's really important to talk about safer sex in the department. One part of the safer sex message is talking to young people, or all people, about condom use and how that can reduce your risk of sexually transmitted infections. So we would discuss perhaps barriers to people using condoms, what would get in the way and how we can overcome those. But safer sex isn't just about using condoms, it's about having the sex that you want to be having, feeling safe in doing it, having the confidence to negotiate what you want in your sexual activity and sex life.
You can talk to a health advisor about any concerns you have regarding sex and relationships.
If someone gets diagnosed with an STI, it is absolutely really important that their partners, certainly their most recent partners, get treated as well. And certainly part of the health advisor job is to initially help people inform partners themselves of infections and getting tested and probably treatment for them. If people are uncomfortable doing that, then we offer a service of informing people anonymously about infections. So we would ring someone up and say, we have reason to believe you've been in contact with an infection.
If you have an STI, then anyone you have had sex with needs to visit the clinic too.
Hi Anna, have you got any questions about what the doctor said to you today?
Well, he wanted me to come and see you because I've got this concern about my boyfriend. He won't come down to one of these clinics, and I don't know why.
It's quite common for people to be nervous about coming to one of our clinics. Have you ever thought about asking him if he'd come with you? Now, lots of couples come together and then they can have their examinations separately and then come and see a health advisor and talk about, questions they have together. It's kind of safety in numbers, if you like.
Staff are very experienced and friendly and will never judge you. Don't let embarrassment stop you going for a checkup. The best way to avoid STIs is to use a condom every time you have sex. Find your nearest sexual health clinic by calling NHS Direct on 0845 4647 or go to www.fpa.org.uk/find a clinic.